Okay, this is going to be really good, folks. Surgery or total replacement? Boy, this is something. Crystal Clinic is making it easy for you to get back on your feet. We're with Dr. Erin Dean right now. She's an orthopedic surgeon. So great to see you. And I remember when they first came out with replacements for your knee, and that was like a miracle. I'm old enough to remember that. When I heard you were talking about ankle replacements, that's unbelievable.
Yes, yes, it's a great advancement. It's offered so many additional benefits for patients and much better outcomes, I think, than total ankle, or I'm sorry, than the fusion alone that we used to do.
Right. So I mean, so when they do this ankle replacement, you have total motion ability of the ankle then?
You retain the motion at the ankle, yes. So that up and down motion that you're talking about there, you keep that, yes, which is great.
Keep that old tendon in the back working there for you. So,
correct.
Yeah. So do people come to you like more this time of year, or they're slipping on the ice and that kind of thing? Are these athletic injuries? Are they people that are just elderly?
So, ankle arthritis often happens after an injury, but it's not right away after an injury. It's usually years down the road. But injuries certainly are the #1 cause of arthritis in the ankle. So this time of year, yes, we see a lot of ankle injuries from slipping on the ice. I've had a whole slew recently, unfortunately, of broken ankles. We repaired those back up, and definitely down the road, there's the risk of arthritis. So it tends to be older patients, but
yeah, we were talking about knee replacements earlier, and now hip replacements. I remember people used to do those, and they'd be down for a week or 2 weeks. Now you're up the same day or the next day, and you're in great shape within a week. What is the prognosis on the ankle? How fast do you recover from that?
So the ankle is a little bit different than the hip and the knee because there's not as much soft tissue around there. We have to let all the soft tissues heal in. So it's a couple of weeks of really, being in a splint, not walking, not moving it. And then we start 2 weeks after surgery, we start moving the ankle, getting that motion going, putting a little bit of weight in a boot. And then usually by the time we're about 6 weeks out from the surgery, we're progressing with walking and getting into a brace and trying to get back to life.
That's a miracle for someone who's having a tough time walking because of their ankle. So you have 11 locations for Crystal Clinic. Is there special ones for this, or can you have this done at all of them?
So we have 3 different foot and ankle specialists at Crystal Clinic, which cover most of our locations. There are a few that don't have one of us there, but I'm in Hudson and Kent and Broadview Heights, and some of my partners are covering the other ones. So most of our locations, there's a foot and ankle specialist that can do it and can help.
What are some of the symptoms that present to tell you that you might be on the road to needing this ankle replacement?
Sure. It's usually pain and swelling around the ankle, usually right around the front of the ankle. Okay. Worse with activity, worse first thing in the morning, stiffness in the morning, things like that. Yeah.
I know, so you're talking about sometimes this happens to older people, and older people have problems with circulation in their ankles and their feet. Does that present problems that you can overcome?
It does, yes. You definitely have to have good blood flow to your leg to be able to safely do a total ankle. But that's something we always assess, and if somebody doesn't have good blood flow, we definitely refer over to people that can help with that to get some good blood flow to the limb to be able to help, yeah.
So people who are just discovering Crystal Clinic, what is the insurance situation? Do all the insurances work, and Medicare and all that kind of stuff?
We take Medicare, Medicaid. Most of the private insurance companies we take, there are a few here and there that we're not contracted with, but most of them we do.
So that's great. So when you have the surgery, is it a one-day surgery and you go out and you go home and you recuperate at home, or do you recuperate somewhere else?
Usually in the hospital, at least one night. Most people go home the day after surgery, but it's one night stay in the hospital.
So how did you ever decide you were going to work on ankles?
Well, I was a gymnast growing up, so I had all kinds of injuries myself, yes. So with that history, I've had several surgeries on my ankle, and I just liked the anatomy and the biomechanics, and got interested in doing it from that.
So you almost wish you could have done it yourself with what you know now?
Yeah. Right, yeah.
Because things change all the time. I mean, Dr. Mark was telling us he doesn't do anything he was trained to do 20 years ago. Everything has changed so much in 20 years.
Sure, absolutely. I mean, total ankles, they've really just in the past 7 to 10 years or so become more popular. Prior to that, everybody got a fusion, which means you basically fuse the joint together. You have no motion there. and it puts extra stress on the other joints around there. You know, so this is a huge innovation for us in the foot and ankle world, to be able to, you know, keep people walking more normally and protect all the other joints in the foot too.
Well, thank you, Dr. Erin Dean at Crystal Clinic. And if somebody's out there limping around, they don't have to be. Come see Erin Dean, and she'll hook you up. Thank you very much.
Sounds great. Thank you. Thanks for having me.